When we talk about substance use and substance abuse, we have to remember that these are two different things, although they are obviously related. And although a majority of people who use substances will never develop a substance abuse problem, it is true that everyone who develops a substance abuse problem starts as a user. And so it's really important for us to figure out exactly how substance use develops into substance abuse. The first theory that I want to discuss is the gateway model. And this theory might be familiar to you. It says that some substances act as gateway drugs, meaning that their use can lead to the use of other, more dangerous substances. So here we have John. And when John was a teen, or maybe a preteen, he started experimenting with alcohol and cigarettes. And from there, maybe he starts smoking pot, he starts using marijuana. And eventually, he winds up using drugs like heroin and cocaine. So here, alcohol and cigarettes would be a gateway that leads to marijuana use, which is itself a gateway for heavier drug use. So John's early experience with less dangerous substances led him to use more dangerous substances later on. And the implication of all of this seems to be that if you can prevent people, specifically teens and preteens, from experimenting with smoking and drinking and marijuana use, then they will never move on to harder drugs. And this is the basis of a lot of anti-drug programs in the US that are targeted at preteens. And there is some support for this idea. First, the order of drug use that I've described here is pretty typical. People who use substances generally do use alcohol and cigarettes before they use marijuana. And it's also true that individuals who use heavier substances did in fact use alcohol, cigarettes, and marijuana first. But there are a few problems with this theory. The first is that correlation does not imply causation. Just because individuals have the tendency to follow a certain path for drug use doesn't mean that one causes the other.